Welcome to today's session titled Healthcare Without Borders. So, today we'll be discussing how digital healthcare is improving the gap and it's also bridging access to undeserved communities. And today we are joined by a medical professional who will be sharing some deep insights on this topic. Doctor, welcome and thank you for joining us. Could you briefly introduce yourself?
Thank you very much, Rejoice. It's a pleasure to be here. I'm Dr. Sam Edja, public health expert and telemedicine advisor. Good to be here this afternoon.
Thank you very much. We're happy to have you here with us. Yeah, so let's start from the basics. What does healthcare without borders mean in today's digital world?
All right, thank you very much for that question. So, healthcare without border in today's digital world means ensuring that access to quality healthcare is one of the very important factors for those who are in the rural community. So it means ensuring that everyone has access to quality healthcare regardless of their location, socioeconomic status, religious background, and even physical limitation. This occurs through the use of telemedicine, all right, digital platforms, and patients are connected to healthcare professionals anytime and anywhere, and this removes that geographical barrier of healthcare.
Okay, you set a strong foundation there. So let's bring it home to Africa. How is digital health improving access to the healthcare in undeserved communities in Africa?
All right, thank you. So digital health is revolutionizing healthcare in Africa by one, connecting the rural dwellers to specialists in the public centers. All right, so patients who are in underserved communities can have access to quality care by interfacing with specialists in the urban areas. Now, this also helps to reduce the cost of long distance transportation. So you don't need to travel from your community or your village down to the urban city to access care. It also provides quality health education using mobile devices. It's also a good platform to monitor disease progress and follow up care. And also, it's important to state that the use of digital health expands access to quality healthcare in areas where you don't have enough healthcare professionals. Thank you.
Okay. No, I wanted to ask how the or what are the biggest barriers that are hindering people from accessing this quality healthcare? I think you even mentioned something about distance. So I'm wondering how can this technology help or solve these barriers?
All right, thank you very much. So maybe I'll start with the one that is glaring and staring at us. So the first barrier is, acute manpower shortage. All right, where you have shortage of healthcare professionals, particularly doctors. We are in a time and season in the world where many doctors in Nigeria have jackpot. So we know about the brain drain and the jackpot syndrome. And WHO had actually recommended one doctor to 600 patients, but the current ratio is about one doctor to 5 to 10,000 patients. So you see that acute burnout. Doctors are fagged out, and that can actually affect the quality of care. The next barrier is actually distance, all right? So distance is a barrier. When you have healthcare facilities far away from these communities, patients cannot really access quality healthcare. So when there are emergencies or they may find it difficult to really interface with healthcare professionals. So digital health bridges that gap where they can stay in their community and still relate and interface with doctors and still get better quality of care. The other thing is high cost of healthcare services. That's a barrier. With the level of poverty currently in Africa and in Nigeria particularly, many people cannot afford quality healthcare when they go to public hospitals. And so digital healthcare gives you that leverage of accessing health platforms, and yet you are paying very little to us, to get health delivery. So this is very important. And finally, I'll talk about lack of health information and awareness. A lot of facilities don't have this coordinated information and technology system. So digital health bridges that gap. And then the solution it provides is telemedicine consultation, mobile health applications, even the use of artificial intelligence to aid in diagnosis, remote patient monitoring, and electronic medical records can be stored, and then you can always call back those records for follow-up and continuity of care. Let me just end by saying that digital payment and health insurance is also very important with this digital health system. So you can link up health insurance system with digital health. Thank you.
Okay, thank you very much for that wonderful insight. And with what all you've said about barriers and how we've already seen how technology is clearly becoming a bridge. So now for telemedicine, what's like the patient outcome if this has been implemented? Like how does it improve healthcare outcomes for patients in remote areas and underserved communities?
Yeah. Yeah, thank you very much. So digital health actually enables early diagnosis and prompt treatment
Okay.
of diseases. So with digital health, there's access to early diagnosis, which affects the outcome actually of care. It also provides access to specialists without you necessarily traveling to meet them wherever they are. All right. And then it also improves adherence to follow up. All right. So patients who are on long-term medications adhere because it's easy to keep to the appointment via digital appointment rather than giving appointments in the four walls of the hospitals that sometimes because of the overcrowding, many patients don't want to go to the hospital environment. So it also improves in follow-up care and adherence. And then it lowers healthcare costs for patients. I've said that before. It's going to be very easy for patients to subscribe and go online to see their physicians most of the times when they need them than pay their way all the way to the hospital environment for consultations. Ultimately, telemedicine improves patient outcomes while enhancing convenience and accessibility. Thank you.
Thank you for that, sir. So I'd want to know what's the role of MySmartmedic in bridging this healthcare access gap. MySmartmedic is a telemedicine platform. So what's the role of MySmartmedic in all this that we have discussed so far?
All right, thank you very much. So my Smart Medic is a new innovation in Nigeria. It's a telemedicine app that has been put out to provide virtual consultation with qualified and certified medical doctors. So the doctors are actually licensed by Medical and Dental Council of Nigeria, and they are highly skilled professionals. So it also offers convenient healthcare services through digital platforms. And one of the very interesting innovation is the wearable devices that my Smart Medic also brings on board. So these devices can monitor blood pressure, heart rate, and other vital signs. And then they can be on the spot assessment by the, specialists to see how well their patients are faring. Right. So my Smart Medic also helps to reduce patient waiting time that we see in the four walls of the hospital. So that also helps to reduce patient waiting time and overcrowding that we find in the hospital. And then it also supports healthcare and preventive healthcare and then health education by promoting healthcare. Thank you very much.
Okay, thank you very much for that. We've discussed on how my smart medic helps the patients, covering distance, cost of healthcare, gives better access to quality healthcare. So in doing this, you see that beyond this access, what's like there's also like a pressure on the healthcare on our healthcare system. So I would
Absolutely.
want to know like how can this digital technology reduce the burden on on hospitals, on healthcare professionals, on healthcare institutes?
All right, thank you very much. Now, this is very important. If you go across the public hospitals in Nigeria, you will find overcrowding in the clinics, in the emergency room. So, digital health that is being offered by My Smart Medic bridges that gap by addressing minor illnesses. So you see the simple cough and catarrh, upper respiratory tract infection, and malaria that should naturally go to a teaching hospital can be addressed by a digital health platform. So that reduces the burden and the pressure on the health system and even the health workers who are already few. It also streamlines appointments, all right, and patients triage. So the digital health helps to triage patients, all right. Triaging just means picking out those ones that are dire emergencies and deal with them. It also supports remote monitoring of stable patients. There are many stable patients that go to the hospitals that don't have any business entering the hospital. So my smart medic can monitor stable patients while the hospital environment can focus on critically ill patients and unstable patients. All right, so this is very important. Finally, it improves communication between the healthcare teams. So there can be that intersectoral collaborations where referral systems can be achieved. So digital health can actually refer clients to the hospital environment for further follow-up. Thank you very much.
Thank you very much for that. I think I now even understand better the value this telemedicine platform brings on the patient's end and the medical professionals and institutes as well. So, when things or technologies like this come out, there's always this misconception, there's always this thought, especially us here in Africa, about, oh, what are the measures that have been taken in place to ensure that, okay, my data is safe. What about the people, the doctors that I'm talking with, are they qualified? I'd want you to, like, maybe talk more on these misconceptions and what a platform like MySmartmedic have done to resolve them.
All right, thank you very much. So, talking about misconception, it is normal. Whatever is new, many people will have their doubts about it. Well, some of the misconception could be that can doctors really diagnose patients online? So, can there be proper diagnosis of patients? The truth is, yes, patients can be diagnosed online. All right. So, my smart medic has that leverage of qualified medical doctors practicing in Nigeria that are experts in making diagnosis and treatment of patients. The other could be, can virtual consultations be more effective? All right. Yes. If you go to the Western world, you find virtual consultations happening and they are getting good outcomes. So this is why my smart medic is introducing this platform in Nigeria. The other can be data, privacy. And
Yeah.
my smart medic has actually gone that far to ensure that there's cyber security and data privacy. So your data is actually secure. And then lastly, one of the concerns I need to bring up here is patient confidentiality. And many people will be concerned about their health record, right? But
Yeah.
my smart medic is also very big on patient confidentiality and health records. And this has been taken care of. I can tell you that.
Okay, thank you very much, sir, for answering that question. So, looking beyond today, so it's important to know where all this is heading to. And I'd want to say, how can the government, other healthcare institutions, how can they collaborate to ensure that we work together to improve healthcare access across Africa and even Nigeria in a sustainable way?
All right, thank you very much. So government has a role to play definitely in telemedicine and digital health. One of the things the government can do is to develop supportive policies and regulations, policies that will enhance and sustain the use of digital health in Nigeria. The government can also invest in digital health platforms. There's room for that level of investment and collaboration. Government can also train healthcare providers in digital health competencies to make them, come up to speed with current realities. The government also has the potential of ensuring that undeserved communities underserved communities had to reach communities have access to stable internet. This is very important because when we talk about digital health, you need stable internet, to actually access it. So government can go that far to give, you know, free internet to the communities. And then government should also work hard in ensuring data privacy and cyber security, which is very important. And there can be some level of collaborations with other health institutions to ensure that, like the National Health Insurance Agency, can come up to speed with the digital health system, where they can link up referral systems from the digital health platform to public hospitals. Thank you very much.
Thank you very much for that. I think we all have a role to play in this, and I'd want to
Absolutely.
say, what are the trends that Africans or Nigerians as well can be listening or watching out for over the next 5 years? For example.
All right, thank you very much. So there's so much happening in the world, and the world is moving very fast. So with the advent of AI, artificial intelligence, everything has to go very fast. So we should look out for trends like artificial intelligence, assisted healthcare delivery system, which is already happening. We can also look out for remote patient monitoring using wearable devices. I have said that. This
Yes.
is also a very good innovation we should look out for. Mobile health is another one, something called mobile health, digital therapeutics, and virtual hospitals and telehealth networks. All of these are innovations that are coming up in the country and in the world at large. We need to cash into it and ensure that Nigeria is not left behind. And lastly, I'd like to say that these innovations will significantly improve healthcare accessibility, quality of healthcare delivery, and efficiency across Nigeria and Africa at large. Thank you.
Thank you very much for that. I'm even particularly interested in the wearables because I'd
Yeah,
want something that can be updating me as I go.
absolutely.
Okay. So to wrap up, there's what advice would you give to younger professionals, your colleagues in the field, innovators, and who would want to drive change in Africa, who would want to take this digital health to the next level? What advice can you offer them?
All right, thank you, Rejoice, for that question. So my advice would be first, embrace technology as a tool for improving patients' care and outcome. Everybody has to embrace technology. Number two is to focus on solving real healthcare issues at the community level. There's been so much, focus in, the urban areas. Let's go down to the roots. So focus on the bringing innovations that will provide quality healthcare services at the community level. And then there's room to develop multiple disciplinary skills and approach to patient care. So everybody, in terms of leadership and technology, everybody has something to offer, and then promote evidence-based and patient-centered innovation. I also want, young minds to think about the possibility of making more money by subscribing to digital health. So when you are innovative, it means more money will come to you. All right. So that's
Yeah.
very important. And finally, they should prioritize affordability, accessibility, and equity, even as they drive digital health. Yeah, that's what I will advise.
Doctor, thank you so much for sharing these powerful insights with us today. I think we learned like a whole lot. And to everyone watching this conversation is just the beginning. And we want to thank you very much for joining us on this session today of Healthcare Without Borders with my Smart Medic and Dr. Sam Eja. Thank you so much for joining us today. We hope to have you next time with us.